we're doing a little bit of a different sort of live session today. I know many of you tuned in yesterday for our community, live session, part of the New Normal series with the Bangladeshi community, talking about COVID-19 and how it has impacted the Bangladeshi community. So today, because we've been getting a lot of questions, we've been talking to a lot of folks locally. I wanted to just take a moment to answer your questions. And just have a chat with you. So, as folks are coming in, welcome. Thank you for joining. And obviously, if you have any questions, comments, please leave your comments, and we'll be happy to answer those. Also, while we're doing that, I just wanted to tell you that I have this really beautiful Cherapita chili plant. It's a very special type of chili that that actually someone gave us, just the seeds, and my mom actually helped me grow this plant. I'm very excited, and the chilies look really good. They're very, very nice. And actually, this was I think in March when we started. So as I kind of take a moment for people to join this live today, I want to talk a little bit about what's going on in Parliament. We're there this week and next week, and the House is supposed to rise after next week. And recently, the Auditor General has come forward with two reports. She was actually supposed to release a report today, I believe, or tomorrow, and now we're told that she'll be releasing that report next week. But the last week we had the Auditor General, who is an independent sort of body that is supposed to keep the Premier accountable. We had the Auditor General's report come out, and it was about the way the Premier has responded to COVID-19 and the measures that he's taken. It's really interesting because in the past, in 2017, 2018, we have seen the Premier talk about how great the Auditor General is when the reports have kind of sided or helped some of the things that he was doing. But recently, when the Auditor General has been critical about the way he's looked at the environment, the way the Premier has been approving a lot of different large developers' applications for a lot of constructions happening across the province, undermining, environmental impact assessments, undermining conservation authorities. So the Auditor General actually came forward and criticized a lot of that. And now what we have the Minister of Health, we have the Premier actually questioning the Auditor General, who is an independent body, just because she has published something really analyzing how the Premier has addressed this pandemic. The other thing that I also want to talk about today, so make sure ask your questions if you have any questions about housing. We recently released our housing plan. We have also released our long-term care plan, talking about how we can make sure that our long-term care system, as well as home care, because let's step backward a little bit and talk about seniors care. When we talk about long-term care, sometimes we forget that a lot of elders, a lot of our moms, dads, grandparents, they don't actually want to go to an institution. Sometimes these long-term care homes, actually a lot of the times, these long-term care homes are sort of this hospital-like buildings that is not really a home. And I know, speaking from a lot of local residents, they don't want to go to a long-term care home. They want to stay home. They want to be with with their spouse. They want to be living where they lived all their lives. They want to have their own homes where they feel more comfortable. A lot of people with dementia, for example, feel disoriented when they go to a long-term care home. So when we look at elder care, for example, we need to look at all these different pieces. And that means talking about home care. That means talking about, providing PSWs and the support that someone needs when they're home, which may not be something where they need to go away from their home and be in an institution. So our long-term care plan really addresses a lot of those pieces, and and it's a very comprehensive plan to look at how do we make care of our elders about care, about their well-being instead of profit. So really taking profit out of the whole care system. Um, and that, we saw during this pandemic how that has been a huge problem with the way long-term care has been, with the way we have lost so many of our loved ones. We have lost so many of our elders during COVID, not because, not because of COVID, but because of how, uh, how much exposed they were to COVID, or the lack of care in many of these long-term care homes. Um, so yeah, so feel free if you have any questions about that, feel free to ask that those questions as well. If you have any questions about our housing plan, we recently posted a little bit about that. So, I'm happy to answer your questions on that as well. Our housing plan also, I think, does a really good job of taking many of the feedback that you have given us throughout the past 2 years, which is, looking at how do we help people live a life they can afford. And when I get to do my weekly meetings with constituents every Friday morning, we talk to almost every week. I get someone who is applying for housing or who is waiting um, and is worried that they are, that the wait list is too long and their wait is probably 8 to 12, 13 years long, and it's just devastating because some of these folks are in their 60s, 70s, and don't know what what they can do. A lot of single mothers, for example, a lot of families that really need that support. And housing has been the whole system has been in a crisis. Um, so the plan that we have really looks at how do we make sure that people have access to affordable housing, but also looking at providing affordable rental apartments, and then making sure that for many families that dream to one day own a home, making sure that we are able to actually imagine how we can afford to buy a property in the neighborhoods that you lived in for all your lives. In Scarborough Southwest, for example, I know a lot of families, a lot of the folks that I went to SATEC with, actually I went to Joe Courtney Brown before that, but in that whole area between Beaches East York and Scarborough Southwest, we know how expensive property prices are and how it's almost impossible to dream of buying a property, especially for a lot of the new families, a lot of the young folks. And this plan really has these tools to help you. So making sure that we are actually helping people with their loans, helping people put their down payment, and actually imagining buying a house for the first time. And then I think the other part of it that is really important is for those of us in this community who actually have a home but want to make sure that they are able to, let's say, make it easier for their for their extended family members to live in a laneway apartment or laneway housing or their basement apartments. A lot of that has been very complicated, and also for Scarborough Southwest, sometimes it's harder to get permits for certain things, for these easy, smaller, permits that would actually make it easier for families than it is on if you just go a little bit west of Scarborough Southwest. And we think that's not really fair. It would make so much more sense for a family that has children that want to live with them. It would make so much sense for folks if they want to rent out their basement, for example. So really making it easier to have that, and making it a little bit more affordable for families. So to all of you who are joining in, thank you so much. I think we're getting some questions. I've got a question about vaccines and mental health. So yeah, I know I'm really hoping that some of the news that we're getting in terms of the availability of vaccines, I think I'm really hopeful that we will be able to get vaccines very soon. I'm hopeful. I also want to make sure that we are keeping our government accountable in terms of how we distribute vaccines as well. So it's making sure that it's done safely, and also making sure that it goes through the approval process as fast as possible, but also with the best sort of you know the assessment is done so that people have access to something that is safe for them to use. Um, the Should we fund municipalities? And to all the folks joining in on YouTube, we're not completely used to using YouTube all the time, so I'm really happy that folks are joining on YouTube as well. Someone wrote, should we fund municipalities to start building more affordable and cooperatively owned housing as a source of income? Okay, so I'll come back to that. Let me just finish with the other question that I had about mental health. So vaccines, definitely, I hope that we can get folks to folks vaccines as soon as possible. The other thing is we have heard the Minister of Health talk about Minister of Health for Ontario, Kristen Elliott, talk about making sure that they are going to give out vaccines the same way they have been allocating the flu shots. And I'm a little concerned when I hear that, because that means that we have seen what they've done with flu shots and how people have been lining up for hours, going home without any luck, and the system hasn't really worked. So we're going to make sure that we push the government to have a system that works, have a plan that works, to have a process for folks who really need it, folks who are in desperate need, and obviously demographics of all older population, making sure that long-term care homes, making sure that some of the vulnerable communities really get the supplies fast enough. A big shout out to Nasreen Sultana, who joined in. A huge, she's actually fantastic woman who's volunteered with us many times. Also to my friend Anita Ko, someone who's been advocating for long-term care with me, and a big shout out to Alex as well. Both of you has been champions during this time, fighting for their grandma, and someone, two people that I truly admire and haven't seen in a very long time. So to you both, I look forward to seeing you sometime soon. Yeah, so on the piece of mental health, I think it's really important for us to recognize that during COVID, being alone at home can mean so many things. Sometimes it increases the amount of violence they are exposed to when you're home from family members. Sometimes it also means that for people who have been on the wait list and need support, or are usually folks who are able to go out there, don't really have the means to do that right now. I've talked to women who have had to deal with violence during this time. We have had to make really tough calls in terms of how do we protect a lot of these folks who are reaching out to us during this pandemic. A lot of children are also at risk. But in terms of the mental health piece, there is so many things that was wrong with it even before the pandemic. We knew the wait time was really long, and just the idea of imagine some of our grandparents, some of our moms, for example, from racialized communities, who who were stuck at home during this pandemic, and really, in whether you had jobs and you lost the jobs, whether you're from any parts of the world, and had a community where people were all around you, and now you're stuck at home all the time, and not have just people to talk to sometimes. All of this can have such a huge impact. and it can be devastating. I cannot even imagine for folks who are going through a difficult time, dealing with the mental health needs and addiction support. And right now, we know from the budget, and I want to say this because, and I know we shouldn't make this political, but the point that I'm going to make is when I looked at the budget last week, it does not have any provincial funding allocated for mental health support. No new money. Everything that they have right now is in the last year. They're sort of continuing the support without really taking into consideration the increased need during COVID. And to me, that's uh, really problematic, because we're going to, I hope we'll get through this pandemic, and we will. I know together we will get through this. But right after that, there's going to be a lot of other problems that we'll have to address, we'll have to face. And mental health will be another one. Um, and that means, making sure that people have safety nets. I mean, just a few days ago, we got the report that now the wait time is about 2.5 years to get counseling support for folks. And then, yesterday we also talked about how there are different barriers when you call in a helpline. What does it mean when you call in a helpline? I remember when I was a student, and I felt like the world was on my shoulders, and I needed to talk to someone. I called at support at U of T, and they told me the wait time was 6 months. Um, and I know this from personal experience. I have talked to so many other students when I was at U of T who went through the same thing. And now when I talk to students from colleges and universities, they tell me it's more than a year, more than 2 years, and how they are trying their best to fundraise to be able to provide counseling support, to provide professional help. Because we need to be able to do that. And if people are going out of their way to provide that support, it means that, we as government need to do much better. The other comment that we had was about municipalities are start building more affordable. Yes, absolutely, affordable housing, cooperatively owned housing. I am 100%. I told you at the doors 2 years ago, I will continue to fight for this. This is something, my friends, I 100%. Co-op homes are some of the best ways that we can make sure we have affordable housing for the entire province. It's a system that works. We have communities in Scarborough Southwest. We have families that have grown up in co-op housing, and it really is an effective way of making sure that we build communities. It just makes me so frustrated when I see developers just trying to put buildings without really taking into consideration what a community needs. We're not supporting our school. We're not supporting, libraries. We don't have grocery stores. All of these essential services and goods that we need, and yet you just want to build, big buildings and sort of just stack people there, and that's not how you build communities. So absolutely, we have to make sure that we start building more affordable homes, but we have to do it very carefully as well. The other comment that we had from Nasril Sultana was, she said, Assalamu alaikum, wa alaikum assalam. What plan do you have for COVID affected families? It has so many problems to deal with: cleanliness, cooking, mental. Yes, absolutely. All of those things, sister. I think you have, check out our live from yesterday, where we talked about quite a few different organizations in the Bangladeshi community and the work that they're doing to provide, families with support during this COVID pandemic. And that, whether it's groceries, whether it's mental health support, whether it's providing sort of physical activities during, through Zoom calls or on the phone. There are some elders who actually stay on the phone just to kind of have a conversation and hear what's going on. And they do it as a group. virtually. So there are some really good things that folks are doing, organizations are doing, that we talked about. But we'll also do some more conversations with other organizations that are doing some great work in different diverse communities. So we'll bring those in, and obviously we've been sharing some on our social media, on our newsletter. So if you haven't signed up for our newsletter, make sure to do that. You can just leave your comment and leave your email address, or you can send us an email, and we'll make sure that on our live actually comments we share our email address that you can email us with, to make sure we add you to our newsletter, so you can get all the updates with organizations that are supporting locally, as well as the work that we're doing from our office. And if there's any families, anyone who's listening here, if you need any help, if you need even groceries, if you need support with mental health, or if you're going through, whether it's ODSP, whether it's the healthcare system, whether you're having trouble getting a flu shot, any of this, please reach out. We're here to help. That's our job. And even if we can't find the help immediately, we'll do our best to find an organization, connect you with the right people. I know it's a tough time, and we'll do our best to make sure that we can get you the help that you need. The other question was from Anita, who wrote down long-term care homes is a critical discussion right now. It's a push to allocate more long-term care funding into home care. Yeah, I agree with you. I think it's, it's really frustrating, because we know there's more long-term care buildings being built right now. So in terms of the actual beds, we will get an increase of the number of beds, I'm hoping soon, because we need those as well. But when we look at home care, the support has been very limited. And to tell you the truth, I think we just need an NDP government. I think we'll have to wait until Premier Ford is voted out, because I do not believe Minister Fullerton, or Premier Ford, or Minister Elliott have it in them to actually provide the essential support we need our home care system, and that's just the reality of it. It it's how history has been. We have seen with the Mike Harris conservative government and what they did to our entire care system, how they privatized long-term care. And then we have seen with the former liberal governments, one after another, whether you're talking about McGuinty, whether you're talking about Kathleen Wynne, and then now with Stephen Del Duca, we know he was part of the government in the previous governments. He was a minister who did nothing to help long-term care, who did nothing to provide the support that people need in home care. And we have had a fantastic plan for a very long time, and we're actually costing it to make sure that we look at how the money is coming and how it'll be spent. One of the things that I always it's always really entertaining to watch governments do, which is when they announce funding and when they talk about the money they're spending, is 95% of the funding is federal, or we have we're spending $45 billion on COVID response, which is what we saw with the provincial government recently. Where is that money coming from? It's coming from people's pockets. It's the hard-earned tax dollars that people have earned, and they're the one who gave it to the government. And it's this money needs to be spent wisely. This money needs to be, every penny needs to be counted for. And it's a very it's disgusting to see governments take that money and pretend like they're doing people a favor by spending people's money. And the fact that we have so many politicians sort of come out and talk about this, and I think it really goes to show how sometimes people forget that the job that we're given and the people who trust us with this responsibility that we have, and the when people pay their taxes, that chunk, it hurts. For people to be able to get through right now, to pay rent, to be able to buy their groceries, to be able to pay their mortgage, provide for their family, and on top of that, they're paying their, whether it's property taxes, whether it's municipal, provincial, federal, all of the taxes that they pay. It's people's hard-earned dollars that needs to be, every penny needs to be spent very wisely. And so when we have plans that actually help people, we need to make sure that we actually spend it on people. Recently we saw the government spend about $1 million on their COVID response command table. So analyzing how their COVID response command table will look like, they actually spent about $1 million on that. I mean, the fact, and that's how sometimes government spends money. And I want to pull up. So today, actually, let me see. I'm going to give you the exact number for this because we posted this today as well. It's just so disrespectful to people. So according to the Auditor General's report, the government actually hired McKinsey at the outset of the pandemic, and I'm reading from the Auditor General report, the pandemic, to create an organizational structure for the pandemic response at a cost of $1.6 million. And McKinsey also assisted the government with its COVID-19 recovery planning at a cost of $3.2 billion. $3.2 billion was spent on a consulting firm. Of that, $942,000 was spent to provide feedback to government on the childcare and school reopening plans, and said the spokesperson for Education Minister. $942,000 for feedback. Because all the ECs and all the families, the parents, the educators, all that feedback just goes to the dump by the government. That they don't even take into consideration all that feedback that people have been giving for years. There is so many advocates who have written reports. There is the CCPA. There is, we have had Martha Friendly. We have had Charles Pascal. We have had Carolyn Ferns. We have these people who joined us actually on our lives in the past, talked about some of the things that we need for our education system, talked about what we need for our childcare. Why do you need to spend almost $1 million for feedback on how you're going to have the reopening when you didn't even follow a safe reopening plan? And this is how the government is spending our money. This is how the government is spending your hard-earned dollars on consulting firms and on their friends and on feedbacks. It's so disrespectful, and it's just so disrespectful by governments after governments that continue to do that. So I think the fact that there is $3.2 million that was spent there instead of helping long-term care homes have more PSWs, helping our hospitals get more staff, helping staff have PPE to be safe. I had a meeting with the CEO of the Scarborough Health Network, our Scarborough hospitals, just yesterday, and one of the things that she talked about was that our infrastructure in Scarborough hospitals are very old. So so for example, the path that you go to for getting COVID tested, or if if you have COVID, and the route that you take to go to the emergency room is the same route that you take, the same entrance that you take to go to the hospital, because they don't have the infrastructure built to have sort of separated entrances. And she was just talking about how the infrastructure is such that it makes people exposed more, and they're trying to do everything possible. The doctors, the nurses, the whole team is trying to do everything possible to keep people safe. But not only are people at risk, not only are our healthcare workers at risk, the whole community is at risk more because of how how dire the need is for to provide enough funding for our systems, like our healthcare system, like our long-term care system, like our housing system. And it's and it's talking about how we spend our money. Going back to what I was saying is you have to make sure that you spend money wisely. um, if you cannot just spend $3.2 million on consulting and getting feedbacks, you need feedback from people. People are giving feedback. We have, just today I got so many messages from folks who are really frustrated with what's happening in our in the unjust guidelines for our small businesses versus the big box outlets and businesses that are allowed to be open. And to all of you who are listening, and if you have reached out to us, we're working on a petition. We're also going to be making sure that we submit this petition to the government so they know and they're aware what people are feeling. And one of the things I continue to do is make sure that everything that you send me, I will share this with the government, with the ministries, and we will be raising all of these issues and making sure that um, people actually have a say in parliament. People have a say in the way their government's operating. And the premier needs to know. He needs to know what people are feeling. And I'm sure my colleagues and I, the amount of feedback that we have shared, I'm sure that that this government is starting to feel some of the agony, and and I hope they will listen. We also have grocery prices are going up. Can we start an urban farming initiative in SSW? That's a great idea. Thank you. I think that's a fantastic idea. I First, actually, we do have a local food market, the Scarborough Food Market, that I think we actually wrote about. Uh, and I'll make sure that I share the link as well. So they're at West Scarborough Neighborhood Center, and they're there all winter, and they have fresh fruits and vegetables that they sell, which you can go pick up. I'm forgetting the date right now, the days that they're at actually, but I'll check that out and see if I could post that for you. But in terms of having some of the local folks, to be able to grow your own vegetables. We do have some municipal lands that some local folks actually use. So just close to where I live, we have the Prairie Drive, where there is some really cute farming spots that people from the Teesdale area and the community there actually come in and farm there. And it's the community gardens that we have. I'm always an advocate for local community gardening and making sure that we continue these initiatives. I was actually, let me just tell you, I was so proud of the way some of the community gardeners um, came forward to help us in, I believe it was in March or April. So right after the pandemic started, we knew that the local gardens have closed, but because the gardens are sort of independent and you have one or two family members that usually just go and farm there, um, the gardens are actually quite safe for you to go on your own and do what you do and grow some vegetables. And these vegetables, are a good resource for your family, but some people actually donate as well and give it to their neighbors. Um, and share. So we were able to get enough support from local gardeners who actually pushed the government to open up some of these gardening hubs. And I'm really proud of our Scarborough Southwest gardeners who joined me, had some conversations about that, and big shout out to all of you for that. Also, thank you, Ward Smith. You're such an awesome friend who joins us here on our lives all the time. The question you asked, yeah, so absolutely. So thank you for joining. You were there yesterday. We're speaking in a different language, but I know that you're actually getting the main idea of it. So I'm glad that you joined us today again as well. Let me see if I can find actually something that I want to share, which is oh my God, let me see, what's his name? I was just going to share actually the name of the group. Um, the name of the group. So we had quite a few organizations that actually came forward, but I will do that next time. The Oh, Scarborough Co-op Market. There we go. So thank you, John Beers. Scarborough Co-op Market is the place at the West Scarborough Neighborhood Center that you can go ahead. I'm trying to multitask here, so I'm trying to find a bunch of things. So I have Maisha who's helping me, and now I have John. Thank you for that. And to those of you who's wondering, the plan that I have actually, it was from that initiative that we started, and then I had a conversation with a fantastic gardener and a gardening enthusiast named Mr. Akhtar Hussain, who actually grows, who actually has his own plot that he gardens and shares with everybody. So he gave us some of the seeds for this charapita, and apparently it's a Peruvian chili that's very rare to find, although now I know a lot of our families and uncles and aunties have this plant. It tastes delicious and it looks beautiful, so I'm very proud of that. The the gardening folks also have been really great in terms of sharing their food with some folks that they needed this time. And we know some of the food banks are going through a difficult time. And on that thought, I do want to share that a lot of people have come to us. And actually recently when I was talking to members of the Scarborough Food Security Initiative Food Bank, one of the things they talked about is not only do we need food, but we also need essential like sanitary products, hygiene products, because those are not, the usual things that you think about when you're talking about food bank donations. So what we started is from today, we actually had our first day for our drive, and tomorrow and Friday we'll be continuing the drive to accept and collect. Just hygiene products, so for women and children, moms and babies, basically anything that that you can donate, whether it's baby formula, baby wash, diapers, adult diapers too, pads, tampons, all of those things that people need to stay safe, to be healthy, but are sometimes harder to find in food banks. So if you could spend a few minutes and come out tomorrow or Friday and donate, it'll be amazing, and all of it will go to the local food bank, the Scarborough Food Security Initiative Food Bank, located at 2229 Kingston Road. Yeah, we have some folks who joined in as well. I want to remind everyone, and actually we will wrap up in a few minutes as well. Thank you all of you for joining. As we continue this fight, I hope that if you're able to also go out and buy local, it's and if you want to come and donate to our food drive as well, to the essential product drive from some local shops. Buy local because they're having the hardest time to survive right now. And we talked a little bit about how some of the big box stores have an unfair advantage right now, but it's really important for us also, while we push the government, while we're trying to make the premier understand what he's doing wrong, and really get them to act. Let's do the best we can as individuals, and if you're able to, please go out and shop local, whether it's a local restaurant. We have some really, really good restaurants around Scarborough Southwest. We have some local shops. Please go out and support. And a little bit goes a far way, and they really need it this time. Encourage your families and friends to do the same as well. If you do get a takeout, tag us. Make sure you take a photo and tag us, and let us know what your favorite places are, what kind of food you liked that's in Scarborough Southwest, and make sure to share that with us as well. Let's see if we have any other questions. We'll try to continue to do this as well, so I'll see you in the next couple of days. For now, I will say good night. I think we And if I missed anyone's question, I will try my best to answer them in the comment section, and we'll share the link for the um, co-op food market, as well as our email address, so that you can sign up for our newsletters and stay up to date. Thank you so much for joining me tonight. Stay safe out there, stay healthy, and good night.